Hi, how was your day?
Long. Had a
Yeah?
clinical rotation today, or I've been on
Ooh.
clinicals, but
Yeah,
today had some interesting experiences.
I I bet. I bet. I mean, okay, that's actually a really good segue into what I wanted to start by asking you anyway. So let's just start this thing. Because I was listening to a podcast before this while I was working out, and it was like something about being social and cues from people when they're like talking and conversations stuff like that. And so I guess I wanted to ask in your when you're in clinic and when you're working with people and things like that, how much has it developed your social skills
Ooh,
to work with people in that setting?
I feel like it's good to have social skills prior to
Mhm.
because I feel like nothing prepares you exactly for that. So, in some ways, it's very easy to go into like a quiet corner when you're working with patients because you can just read off of a chart and be like, hey, I need you to do these 10 exercises, and you can stay silent the entire time.
Mhm.
But that's kind of just what distinguishes like a good clinician from a great one is
Yeah.
that personality.
Yeah.
So when you reach out and when you say, hey, like, for example, if someone says, oh, I'm in pain, it's like, oh, well, that sucks. That's one way to approach it. Or you can be like, I'm so sorry. I can understand that you're in pain. Here's what we can do to help you. Or I'm so sorry that you're in pain. Let me see if I can adjust the treatment to make you feel a little more comfortable.
Mhm.
So I think part of that, what makes it hard and to develop it is to lean into the awkwardness. So I think my first two patients, I didn't know how to approach it. And they weren't really looking to talk to me that much. And I didn't really know how to make conversation in that sense. So I try to force it like when I was a server at a restaurant. And so I'd be like, oh, well, how's your day going? And they'd be like, good, or I'm fine. So you have to like really break them out of their shell and ask them
Yeah.
something more personal instead of how's your day going?
So you kind of have to skip the small talk if you're trying to like really
Yeah.
get them to answer what you're asking.
Mhm. And
Mm.
we had a guest speaker recently, and this kind of helped me through this mindset was you have to look at their extrinsic motivations and intrinsic motivations. On the surface, they'll tell you, "Hey, I just want to get better. I want to play with my kids," right? But their intrinsic motivation, what they're not really saying is, "I want to provide for my family, so I need to do X, Y, and Z. I need to get into therapy in order to get better in order to provide for my family." But on the outside, it's like, I just want to play with my children, which is a very surface
Mm.
level motivation and something
Right.
that you don't really have to like, you don't have to pry to get the answer out.
Mhm. How
If that answers it.
No, it does. It does. How often do you find yourself in that like or how often do you find yourself needing to pry more?
I think
Um
in this rotation that I'm at right now, actually it forces me to pry because it's what's called a skilled nursing facility, which means it's kind of the stepping off point between the hospital and fully going home. That means something happened in between that forced them to be in a healthcare facility that they're being taken care of and monitored in order to go home. So that's when they get really vulnerable with you and are like, look, the only thing I can't do is stand up from my bed. But that's where its surface level is, oh, I can't stand up, right? The intrinsic motivation is I'm humiliated because of I can't stand up and I can't be self sufficient. So their point is, I want to be self sufficient, not I want to stand up. So it forces you to look at the deeper side of things. Even if they don't tell you, they'll give you kind of indications of, oh, after you walk a little bit, they're out of breath and they look disappointed. That's kind of the like indicator of there's more to this than they're letting on, if that makes sense.
No, it does. It does. It makes me wonder kind of if that's demographic related. Like, is it
It
easier
can,
or harder to pry out of certain like age groups?
I feel like it's actually harder to pry out of the younger demographic because the ego is higher and the confidence level is higher. So
Mm,
when they can't complete something that they've already been able to do, that's when it gets much more difficult and they start to either lash out, get angry, or become resistant to treatment because either they're not believing in it or it's not working to their expectation. So you have to
mhm.
pry even more with them because they're not going to tell you directly their motivation in a way that makes them look vulnerable or makes them look like they're feeling soft.
Okay. I wonder because you said like people have their intrinsic motivations and like a deeper thing. I wonder if their intrinsic motivation just isn't that strong as, or maybe not that strong, but not as strong as 40-year-old man or woman who has a family depending on them who wants to do things with like their grandkids or their parents or their children or whatever it is
Mhm.
versus this 20-year-old who just goes to college and doesn't do much else and hangs out with friends and goes to the
Right.
gym and all that stuff, right? Like there's not as much on the line, I guess. That's interesting. Yeah. I can imagine young people not opening up a little as much as older generation. I honestly thought it would have been the other way around just because maybe like the older generation is more closed off, whereas somebody of a younger generation might be more open to sharing. But interesting that that's not the
I think
case.
it's also not just the age, but also the background that they're coming from, whether it's sports. So if it's sports, right? Some people are forced into sports at a young age because of their parents, right?
Hmm.
So when an athlete gets injured, there's a couple ways to look at it. It's firstly, or do you want to get back to the sport? Is it that important to you? Because that's gonna like show how much effort you put into it and how quick you can get back to playing your sport. Another thing is, are you the one that's motivated or is it your parents that's motivated? Or what does the sport itself mean to you? Like, if you're doing cheer or dance or something and your parents forced you into it, then it's like, mm, it may not be as important because you feel like you're forced to go to practice. So, oh, my ankle's injured, I can't dance. Oh, boo hoo. It's not that bad. But if, say, you talk to a competitive dancer or someone at like a semi professional level, such as the dancers in Dallas, if one of them got injured and there was a big competition coming up, their intrinsic motivation is dance is my passion, it's my life. I do not want to sit on the sidelines and watch all these other people earn what I feel like I'm robbed from because of an injury or sitting out or purely just fear of missing out from. So it
Mm,
just depends on the intrinsic motivation. But sometimes they don't know the intrinsic motivation themselves. It's up to you to bring that out of them.
wow. Okay. So let's break that down another layer then, I guess, depending on what treatment they need. Um, there's different treatment types, or
Yeah.
so I've heard. I've only experienced a couple. Um, so can I list off a couple of treatment types for you,
Yeah.
and can you break down kind of how they work? What are the benefits of them? What are the drawbacks of them? Who is it best for? Those kind of things.
Mhm.
I think I actually want to start with something that I just caught my eye recently was like aquatic therapy.
Okay.
What is that? What is that about?
So there's a ton of benefits to aquatic therapy. There's not a ton of drawbacks. There are what we call contraindications, which are basically concepts or conditions that you already have that are pre-existing that do not allow you to do that kind of therapy. For example, if you have what's called fecal incontinence or urinary incontinence, meaning you don't have control of your bladder and bowel, those are things that indicate, oh, I'm not allowed to get in a pool and do this because of maybe the ripple of the water or the pressure it's exerting on your organs don't allow you to do that because you might let loose, right? Or an open wound, or an active infection, or other things that you're not going to get in a pool because there's probably at least one or two other people that have been in that same body of water and that bacteria can interact. But those are the downsides, or not really downsides, more like contraindications, things you shouldn't do if that's a therapy that you're like looking into. As far as benefits though go, there's a lot of different things. So one is if you're more of a heavy set person, um, buoyancy is good for your joints. So on land, you're going to have all this compression of the joints constantly on your body, especially in an upright position, right? Now, in a body of water, you have what's called hydrostatic pressure. Basically, as much pressure as you're exerting downward into the water, that body of water is exerting back up. So it's decompressing your joints essentially. So the deeper you go into the water, the more decompression you get. So that's one benefit is spinal decompression or joint decompression. Also, going on with the buoyancy, it makes your body lighter. Again, the deeper you go, the lighter your body is. So it offsets the actual body weight going down into the water. So from your hips, that's about, I believe, 50%, 75 at the nipple line, and then 90% at the shoulder line, like right up to the neck. So you can offset up to 90% of your body weight the deeper you go into the water. So that's also a benefit of it. Simple mobility, you're able to get more range of motion without having the gravity acting on you as much in the water. Also, you can increase resistance. So the quicker you move in the water, it's called laminar flow versus turbulent flow. So if you move quickly throughout the water, you're going to have more resistance. Whereas if you move slow and then direct one motion, you're going to be able to get to that point a little quicker. So slow and steady is going to be quicker, and quick motions are going to have more resistance. So you can work on strength. You can also work on natural buoyancy or floating.
Okay. What about massage therapy?
Massage therapy. Also, a couple downsides, depending on if you have any broken blood vessels already, you don't want to massage over those spots. Active infection or cancerous areas, you don't want to be breaking, because if you break a cyst wall, you can let that fluid out and let all that cells out and they'll spread. So massage therapy benefits are promoting blood flow, breaking up adhesions that might be in the muscles, which are basically just fancy words for knots. You can also free up range of motion, increase movement. So those are benefits of it. Again, downsides is pretty much just looking at the contraindications. Or you can also injure muscles by applying too much pressure or too much, which makes you more sore, and that can also lead to DOMS. If you're working out and you're getting a massage directly after, if they'd apply too much, it can leave you sore for much longer and slow your recovery process.
So it's worse for the recovery. So
Yes.
you want to do any sort of massage therapy or massages in general when you're on the up, like 90%, 95% recover,
Not
feeling
necessarily.
fine, or
I wouldn't
okay.
say necessarily that you have to go in that point. You can still go post workout. That's not an issue. It's more tailoring the pressure to the client's tolerance or the patient's tolerance. So if it feels so intense to the point where it's like, I can't do this anymore, this is too much, ease up. There's no need to like put them into excruciating pain. There should be a tolerance level that you shouldn't break. Like stay within the threshold, because then you're going to injure them. Or you might even break blood vessels trying to work out a knot that's maybe not a knot, or maybe it's a lymph fluid. But also, like, certain things, knowing your anatomy is very important to a practitioner. So if you're looking for someone that does massages, just look for someone who knows what they're doing and has had some kind of medical certification and isn't just like an off the street masseuse.
What about things like, I guess the scenario that comes to mind is when in the past when we'd worked together, there was one movement that you had me do, and it was taking massage gun into my hip flexor and then bending back like I'm in a Romanian deadlift, and then pressing forward with my hip with the gun still there. So, and I guess in those kind of movements, what is that trying to achieve?
So essentially, that's what we call active release technique, or ART. Basically, what it does, it creates a fixed point on the muscle, which is where the gun is. And as you move around, that fixed point is still pressuring into that one specific spot. as you bend and extend, you are lengthening and shortening that muscle, essentially stretching it out like a cord. So it's allowing it to have more elasticity and freeing up the mobility of that muscle, also decreasing what we call neural tension. So if you have any like nerve buildup or muscle buildup in trigger points, you can release those trigger points by finding a spot that's really tender and moving around it to break up that adhesion or not.
Is it easier to break a trigger point by doing the active release, or is it easier to do it by more like I'm staying still and the massage is happening to the trigger point? Like
I feel
the
like
massage is moving.
that is up to practitioner preference. I personally prefer the ART method because it's worked for me and it's a much quicker method. Sometimes, like what we call static trigger point release, is where you just kind of hold it and don't move and just kind of let it do its thing and release by itself. Can be slow and a little bit more uncomfortable.
Mm.
Whereas ART is a little less uncomfortable, but you also get more dynamic movement and range out of it. Sometimes the release needs to be applied in a different angle, which is why dynamic movement helps a little bit more. So I find that whenever I find a trigger point, say it's in my pec or in my deltoid or something, if I'm moving it around, I'm changing the angle and the range that my joint can move within the play of the joint itself. Creating that range is going to open up my mobility quicker because one, I'm changing the depth of the fiber, and two, I'm changing the length of the muscle fiber itself.
Okay, I'm following. What about cupping then? Because
Cupping.
I like it. I enjoy it. I've done it very briefly.
Mhm.
I wish I could do it more. There's nobody around me who really does it.
Yeah,
I enjoy it. I just find it very niche.
it can be. I feel like it depends on who you ask. There's a couple different types. I personally do what's called pneumatic cupping, which is just vacuum, where I have a gun which has a one-way valve on it. You attach the cup, put it directly to the skin, and basically what's called negative pressure, it takes the pressure away from your skin and promotes blood flow. Now, doing that is the same, ideally, or technically, it's the same as scraping, but instead of adding positive pressure, you're adding negative pressure. You're cooling the blood in order to give it somewhere else to go. Now, with this,
Mhm.
you can also do it static or dynamic. And same thing with the scraping too. You can do it static or dynamic. I personally prefer dynamic, but again, it depends on you guys. I like to move the fibers around and be able to have that promotion of blood flow in that specific area while creating more motion out of it so I can get the joint, the bones, and the muscles to work in different planes.
So okay, so then what are you doing this for? Is this for taking something that's somebody that's already mobile and making them more mobile, or somebody who's restricted and kind of opening them up?
So there is a fine line, or I guess it's not so fine. There are what we call range of motion norms. So within a certain body part, there should be a norm or a normal range of motion that it's able to hit. If it can fully extend much further than it needs to, it's what we call hypermobile. Now, a lot of people have hypermobile shoulders due to sleeping on their shoulder where it starts to shift. It can cause
Mm.
poor posture, that kind of stuff. Now, if you're lifting and you feel like your shoulder's giving out, more than likely that shoulder's unstable. So there is a difference between having a tight muscle and having an unstable muscle, right? So when it comes to cupping, I like to first test the norm of that muscle or joint functionally in order to tell whether I need to open it up. Because sometimes opening up too much is not healthy. It's not good for the joint, or it doesn't need to go that far. So it just depends on situationally. If it's tight since you just worked out, you're going to want to promote blood flow. But if it's unstable, I'm not holding it on there for long, or I'm not really cranking on it to open range of motion. At that point, I just want to move that blood that might be trapped between the muscles from the workout itself and promote it to move elsewhere. So I might even slide the cup in order to pull the blood from different areas. And when you release the pressure in the cup, the blood disperses back into the muscle and it
Mm.
becomes more surface level instead of trapped deep into the muscle, creating that tightness.
Have you how's your, I guess, success or feedback from people been when you've
I usually
done
get
cupping?
pretty good feedback, but I always do let people know what to expect before it. I usually say like, "Have you ever had a hickey, or have you ever had like suction cups?" That sensation of like having something pulled, that's what you're gonna expect. If the area is very tight, or if there's a lot of blood trapped, the circle will be darker. That's the general rule of thumb. Also, if you crank it too hard, there's a difference between being sore and having it straight up hurt. It should be moderately uncomfortable, but not painful as the cup is on. If it moves, it might be a little tender as we shift over, but it shouldn't be painful. It shouldn't be like a throbbing pain or a shooting pain. It should be like kind of like a numb or like a lighter sensation.
Okay. So then you mentioned scraping, and kind of a comparison between it and cupping. What's scraping about? I've had it done to me too. It's
So
the weirdest feeling in the
scraping
world.
scraping is what we call instrument assisted soft tissue mobilization. There's a couple different brands that have scrapers, gua sha, that kind of thing. It all stems from Chinese medicine. So does cupping, which is why they've brought it from Eastern medicine into Western medicine, because there is scientific backing to it. There is health benefits. People can use it for different things. You can use it for lymphatic drainage within your body and your face, also between like fat deposits. So in your stomach, you can use gua sha or a scraper to be able to flush out those toxins in the body. But if you're looking more on a muscular level and muscular tightness, you can also break down adhesions or those knots by scraping it. So what I like to think of more of an imagery base is the knots are created because there's layers of muscle. They don't all fall the same way. If your body was uniform, muscles wouldn't go in different angles. They lie in different angles, kind of weird. What tends to happen sometimes is they get crisscrossed. And when they get crisscrossed, blood pulls under and the nerves get hot or irritated. And that's what makes the tender points themselves. So
Mm.
as you're scraping, you're essentially realigning those fibers. You're going along the muscle fibers, you're releasing and breaking down any of those knots in order to realign the muscle tissue and free up that trapped blood. So when you hear a muscle knot or a knot release, basically what's happening is all of that blood that was pulled is now releasing, coming back to the surface, and able to disperse back into the body and to be reabsorbed by the bloodstream.
Are there risks involved with it?
Same thing. If you have any like blood disorders, or if you have any like clotting disorders, probably not the best idea to do scraping and cupping, because you don't want to break those blood vessels and have a risk of either a clot or a hemorrhage or internal bleeding. Also, if you're on blood thinners, I always ask ahead of time. If you're on blood thinners, we will not do the treatment
Mhm.
because that is a major risk and a contraindication. Same thing, like I said before, cancer, big no no. Also, never go over like plates, like metal plates. If there are any plates in the body or screws, you don't want to break those up or have those move under you and also break that tissue. So you always just kind of look for previous medical history and check with that. And also check with the doctor. If you have a PCP, just ask, hey, am I okay to do cupping? Or if you go
Mhm.
to see a physical therapist or a massage therapist or a medical massage therapist, ask, hey, I have this diagnosis or I have a history of X, Y, and Z. Am I okay to do this treatment?
Mhm. Okay. So then the last two kind of go hand in hand. It's the sauna and the cryotherapy.
Okay. Sauna, anything with heat therapy, I always say look at inflammation. There's a healthy amount of inflammation and there's a not so healthy amount of inflammation. So if your bones and joints always feel hot, that could be joint inflammation. Now we don't want that. So you would do in that instance, you would do cryotherapy. But again, looking at like circulation disorders and all that stuff. If you have a circulation disorder and you cannot sense or feel or distinguish hot from cold, I would say don't do either of them. Don't do hot or cold because it's not going to help you, and you're going to end up harming yourself instead of helping yourself. With sauna, there's a healthy amount of time to be in there. It should not exceed like 20 minutes. First, from my experience, it should not be exceeded because you can become dehydrated, and also you can also push your body to limits and increase your core temperature, which in some individuals is not healthy. Like if you have MS, you're not supposed to increase your temperature, or if you have fibromyalgia, you're not supposed to drastically increase your temperature because it can make your condition worse. With cryotherapy, we look at something called Raynaud's disease, which basically is like the white dots on your hands whenever you do what's called a blanching test. When you press about 3 seconds, when you release within 3 seconds, that color should come back. Now, if it doesn't, you might have a circulation disorder. So looking at that, we always test that prior to giving an ice pack or something, even something as simple as, oh, I'm going to do an ice massage on you. We have to check that your skin is intact, that there's no open wounds. If you have stitches, you can technically still do an ice massage or an ice pack because it's not entering the skin. You can use like a pillowcase or a sheet on top of it to protect the skin itself. But for a hot pack, it's probably going to cause what's called vasodilation instead of vasoconstriction. Vasodilation basically means an opening of the blood vessels, and it promotes blood flow. So if you already have an open wound or a scratch, adding heat is only going to break down that clotting, and it's going to promote blood flow. So it's probably going to end up reopening that wound, or it could cause more bleeding or infection. With cryo, same concept. We check for open wounds, but it actually will constrict the blood vessels, so it limits the amount of blood flow. So if you have a circulation disorder, we don't do ice because we don't want to further limit that amount of blood flow, and we don't want to cause an ice burn.
So, is there a temperature limit on how high or how low, I guess, generally you would recommend not going?
I would say just go to freezing. Like if you put an ice or a water bottle in the freezer, there's a limit on the temperature that your freezer should go. I say don't go below that.
Mm.
Your like standard, if water freezes at 0 degrees, stick with that. Doesn't need to be that much colder. With cryotherapy, it's a little different. Using like a cryo tank or something, because it's blowing cold air at you. It's not touching your skin per se, like a solid chunk of ice is touching your skin. So it's a little different. You're surrounded by cold air. So you are, again, you want to look at like venous return, or like any kind of like blood disorders or anything that might change your circulation or change your body temperature. You don't want to be in cryo for too long because you don't want your blood vessels to shrink too much. And because in that case, you could pass out or get lightheaded. Same thing with heat. You can get lightheaded from exhaustion or dehydration for being in there too long and pushing your limits everywhere.
Yeah. You know, I've always loved gyms that have a sauna in them, even if it's a one person or the 2-person one. The one that I recently started going to, theirs has been broken for months, basically through the winter. Perfect timing, and now it's back up in the summer. And so after every workout, I end up going in there between like 5 to 10 minutes. I think I should probably start timing it, but I just kind of sit in there and say, you know what, I'm done. I'll get out. It's literally the only way I can sweat. Workout doesn't do anything for me anymore. So it's like the only thing that's like getting me to sweat and like drain a little bit, it feels like. But I've never really tried cryotherapy, which is why I'm curious. I think, to your point, my joints feel more hot than cold, or like neutral. So I'm curious as to what cryotherapy would feel like in the first place.
Cryotherapy will help with, so like I said, there's a difference between joint inflammation and muscle inflammation.
Right.
When you work out, you are creating micro tears in the muscle.
Right.
That's going to create a healthy amount of inflammation. Even say you get a cut, right? Your body's going to raise its temperature in order to protect itself. right?
Mm,
Promote and stop infection. Even if you have infection, that's that line of defense for your body. So that's why you need, in terms of fever, you want to cool your body back down to a normal temperature. You don't want to overheat. But with muscle inflammation, like DOMS or something, cryotherapy is good because it speeds up that muscle recovery and creates more of a neutral recovery point so that your muscles aren't super hot and irritable all the time, but also it kind of brings it back to like a mood point.
Is there an issue with like a hot, excuse me, or a cold shower after like a workout or any sort of like
It
heat
de-
inducing physical activity?
I feel like it depends on if you're going to do activity after. If you're going to do any kind of
Okay.
activity after, I don't suggest ice directly after. I suggest ice when you're like cooling down for the night or cooling down for the rest
Mm,
of the day.
okay.
Now, if you're going to do something after, you could go with heat. It just depends on how intense your workout is. Like if you
Mhm.
want to sweat or if you're burning calories, then jumping into a sauna isn't a bad idea because it's going to raise your body temperature and allow you to sweat and burn more calories naturally through the natural heat of the sauna or steam room.
Mhm. Okay. So then all of these methods, are there any other methods that I'm missing? Maybe I did actually mix one needling and micro needling thing, like acupuncture, things like that. What can you tell me about that?
So, what acupuncture does, there's a couple different ways to look at it. So, there's dry needling and there's acupuncture.
Mm,
Dry needling is looking at creating a microspasm in the muscle by using your body's natural electricity. Okay. You have electricity that passes through your muscles. That's what allows you to contract and relax the muscles because of those synapses that are happening and traveling down your spinal cord through your brain to your muscles, right? Now, when you look at acupuncture, acupuncture is more of a Eastern approach through chi and reflexology points or acupressure points. Now, it's looking like the points themselves are not directly correlated with the actual anatomical point. So, for example, gallbladder is going to be in your hand, right? Your gallbladder is clearly not actually located in your hand, but those chi points and those flow points are connected through that. So that's more of that Eastern approach of these are the points in the body. We can release them by putting a point into that until it releases and lets go. And we'll feel that release, and after we'll feel better. Now, there's nothing to say that reflexology points don't work. They definitely do. But the approach is completely different, whether you're looking at more of a Chinese medicine side of things, Eastern medicine versus Western. With Western, we're looking directly for those trigger points. And hey, I'm tender in this spot. We're going to dry needle that spot. And then it's going to travel on what's called referred pain. You're going to be able to figure out where the pain is actually located, depending on where that pain actually ends up, if that makes sense. We're creating that spasm to release that trigger point directly, and then the referred pain will travel. You'll find the actual root of the problem from there. Now,
mm,
there's a couple different ways of doing dry needling as well. There is tensing, there's also static, where you leave the point in and just kind of let it be for like, depending on your practitioner, probably up to 15 minutes. Even with these kind of things, there are contraindications. So, cancer, pregnancy, there is a lot of things that you shouldn't do for dry needling. You never use the same needle, even if on the same person. Because what happens is when the needle enters the body, if you tap bone, that needle becomes dull. Then when you use it on a different spot, because it's dull, it can end up tearing through the muscle instead of going directly through the muscle fibers themselves. So
mm.
you always pull the needle and use a different one. Bring a fresh needle and always use that one.
This topic is very interesting to me because it's probably the one that I know the absolute least about, and it's the one that I've had probably the worst experience with. Um, I passed out one time when a therapist tried to microneedle, and it was just my thumb right here.
Mhm.
It was 5 a.m. in the morning before work. We hadn't even planned on doing it. I think it was just like a ad hoc kind of idea of, okay, well, scraping has been helping a little bit, but not healing the pain that was here. Um, like the workouts, like the rehabilitative workouts weren't doing much. They said, do you want to try microneedling? They explained to me the risks, benefits, etc., all that stuff. So I said, you know what, why not? Never done it before. If it doesn't work, my risk is the same. If it works, my risk gets healed or it gets better. He put in one, I was already like, oh, I feel light immediately. He put in the second one, I was like, there's a buzzing. I think he pulled out that one that he just put in, I was out. And then next thing you know, I woke up on the ground. First time I've ever passed out in my life. I think, I'm pretty sure. I still to this day don't understand why. What is it about, I guess, something like microneedling where you said it's using different properties, I guess your body's, what you said, your body's electricity,
Yeah.
to help that rehabilitation. What could cause someone like me or anybody to in that situation? Like, how could that happen? How could I pass out? How could somebody like have an adverse reaction?
So there is a threshold that your body can handle of electrical input, and also what your brain can handle. So we had a patient in our clinic that used to pass out every time he got dry needling, but he always felt better because of the actual dry needling itself. So what can tend to happen is that when you put the point or the needle in, it sends that nerve ending a signal all the way up and back down. So you're feeling sensory, right? Then you get the motor twitch, right? So it has to go up the pathway and back down. When there's too much input, it causes your brain to shut. Yeah. So it can cause you to feel lightheaded and pass out. So that's something that we call vasovagal syncope. Basically, when your vagus nerve is overstimulated, and because of the overactive input, your brain just like, I can't handle it, I'm going to reset. And then that's the blacking out, coming back to, and then having that input. And sometimes it kind of sits with you, maybe a headache, maybe that light like buzzing or brain fog. That tends to happen for a little bit. But that's one of the reactions that can happen, is because this is directly connected to your neck. And because the closer you get to your neck, generally, the higher the twitch response, because it's closer to that input.
Can you repeat that word? What was it?
Vasovagal syncope.
Vagal syncope. I'm writing that down because the closest I've ever gotten to the feeling that you're describing, and I've never been able to figure out what the actual issue is whenever I'm doing any sort of grip strength. And once again, it has to do with my hands. Same with the microneedling. Whenever I do anything grip strength related, holding, clutching, hanging, whatever it is, fingertip work, whatever it is, once I reach like a limit of like, I can't, how long can I hang for? Let's say I get to like 30 seconds that one day, and then I start to get an ache in the back of my neck right here. That's telling me like, okay, drop. Like either you will voluntarily drop, and I've kind of pushed it to like a limit at one point where it was almost gonna make me drop. That's the closest I've gotten to any sort of ache, and sort of like a headache or like ache in the back of the neck or ache in that area, which is interesting. I'm gonna look into that to see if there's any.
That's all connected to what we call the brachial plexus. That brachial plexus connects directly from your neck and runs down your arm into your hands. So that is that direct nerve plexus where that bundle nexus right up in the neck. So what we used to do in clinic is if someone would have that kind of input, we would directly needle the top of the neck. And that would free up their hand. And their hand would feel stronger, and that nerve would relax. You'd feel that initial twitch, and then it let go. But then with someone that has vasovagal syncope, you have to be careful and have a pillow behind them just in case they pass out from the overactive input.
Is there a way to release it without needling?
The lacrosse ball.
Repeat that?
The lacrosse ball. So put in the lacrosse ball on not the side, because that's directly where the vagus nerve is, more on the back into the suboccipital muscles. And then either elevating the head or shifting your weight onto the ball, breathing in and out about 5 times, really focusing on the exhale, and try to relax your neck and let it sink into the ball itself. You'll feel your neck kind of melt, but then you can also move your arm to add a little input. Now, changing the arm length is also going to change that trap and how that trap activates into the back of the neck too. So you'll want to release the trap and the suboccipitals. And also going down into the shoulder blade itself will also help that nerve pathway travel.
Wow. Okay. So then I guess going back to what I wanted to ask before we got into the needling, I know all these kind of methods that we talked about, what which are ones that you think are fine for people to self do versus ones that you would recommend
Mhm.
doing with a practitioner?
I would say probably the safest option, aquatic therapy. Can't really go wrong with getting in a swimming pool. Most people do it. Um, Depends on where the issue is. If it's more upper body, it's going to be a little harder to do in the pool because it means you have to get deeper into it. Um, but I think cupping is an easy segue, but they have a lot of high intensity methods to do it wrong. So if you get one of those like electric cups or whatever that like
Mhm.
have a limit, just do your research on how much pressure you should put because each one is made differently and their manuals will have presets for, oh, if you're on thicker muscles, do this pressure. If you're on thinner muscles, do this pressure because you don't want to break blood vessels. Um, Cryo and sauna, also easy ones to do your research on. There's a lot of articles on how long you should do it for, how little you should do it for, when to do it, when not to do it. So,
Mhm. So
um,
things like needling, scraping,
anything that
consent.
feels more skilled,
Mhm.
that you feel like a medical professional should do it, probably you shouldn't be trying it yourself.
Yeah.
Yeah. So a lot of
Yeah.
people I've seen have tried scraping, but they don't know their tolerance limit or how deep or light they're supposed to push and end up bruising themselves instead of just getting that um, surface level reaction
Mhm.
to the muscular release.
Yeah.
And if you press too deep, you'll just have a bruise. And that's kind of the end of story. So do your research. If it feels like you're not skilled enough to do it, don't try it. And also something like dry needling and acupuncture, you need a license to be able to buy those needles. And if they're not certified or they're not like high quality needles, don't go buy them and try them. That's not like an easy way to try it yourself. You need to know your anatomy because it's very easy to one, strike a nerve itself, two, break a blood vessel or open a blood vessel, and three, bone tap, which is incredibly uncomfortable.
Mhm.
So,
I can imagine. Ugh.
yeah, avoid
Yeah. It
dry
sounds brutal.
needling and microneedling on yourself unless you are a trained medical professional and have a license to do so. I would
Mhm.
say that. And then cupping, try it, go light. Use the silicon cups if you're gonna start, because that's a light amount of pressure. And if you're gonna do cupping, use a lotion or something first, lotion or oil. Don't go like directly on skin without a medium because you're gonna end up with like an Indian sunburn. And it's just
Mm.
gonna like pull on the skin and create irritation instead of actual release.
Right. Fair. Good point. Good point. Thank you for that. Can I give you an update from our conversation last time?
Yeah.
Two things you had recommended for people. The first one was I think it's called the world's greatest stretch.
Yes.
I've been doing that. Feels great. Am I doing it enough? No. I've been doing it and it feels great. Highly recommend anybody who's listening. World's greatest stretch. Look it up. Do it consistently. It feels very for lack of a better word, complete. Like I feel like one, I can get mostly everything that like either mobility or stretching. I can get a stretch in any form of it, any segment of it. But within those segments, I can remix it a little bit, whether and make it feel better. Like if I want to hit my hamstrings a little bit more, I'll lean back on my back foot when I'm in my forward lunge, things like that. It's really nice. I enjoy that. Um, The second thing is I did get the clubs, and I love them. They're like quite literally one of the most fun things ever. And where I'm moving to, I'll be able to use them much more than I do now. The bad news is I hurt my shoulder 3 weeks after getting the clubs. Not because of the clubs, because of the gym. But given that I hurt my shoulder, I feel zero inclination to want to use this shoulder with a club, given that I got it for my shoulder. But club bells are great.
Mhm.
I love them. I will have to rock out with these and perfect these first. But I think my end goal is to get those like meal clubs where it's like the entire thing is just the club and then just a small handle. That's like end goal. Like, but that will be in my house before I pass from this earth. I love those two. Those were great recommendations. Coming to more current news. AI. Let's talk about that. I was talking to Wonder a couple episodes ago about AI. I love it personally. For most cases, I just like messing with it. And I'm optimistic about its uses in the medical space. However, my knowledge of it is very limited. It's coming from a more optimistic standpoint than a learned standpoint as of right now. But I guess my question to you is, are there advancements that you're seeing or that you're exposed to in AI use cases in the physical therapy, physical rehabilitation, that kind of work, that kind of line of work?
So I have experimented with a little bit more testing to see what kind of answers it can give and whether they're accurate and or safe. From what I found so far, it's not where it needs to be, and because it lacks critical thinking and rationale in a couple different ways. One is the human approach, knowing that hey, a person had, you know, for example, like a person might have had, blood drawn a couple days ago. They're going to be fatigued. Not giving them the same amount of exercise that they had a couple days ago, or the emotional aspect of things, say death in the family, that kind of stuff, you're not going to do the same amount of work, and it's not going to be appropriate to do maybe the same amount of work or the same treatment. In some cases, oh, I'm going to go easy on them because they're emotionally distressed, or they have clinical depression, or some other complicating factor. It cannot fathom that aspect of it. It's going to give you the cold hard facts. Oh, your diabetes is uncontrolled. Well, we're going to take this exercise really light because of your controlled diabetes. Now, they don't know exercise tolerance. That person might be a full blown athlete. Now, yes, you're probably going to want to monitor vitals, but it's not saying to monitor vitals. It's saying, oh, we're going to take that exercise down to like a tolerable maybe 2 miles an hour on the treadmill. Now, that's probably not appropriate for a professional or semi-professional athlete. They can probably handle about 6 to 7 miles an hour at a jogging pace. So, short answer is I don't feel like it's where it needs to be. I don't know how it's going to implement the human emotion or compassion, because right now it is purely objective. So I think even if you look at just any medical treatment from a standpoint of lacking human emotion, say you had to diagnose a person with cancer and they're displaying signs of that in a physical therapy clinic. Maybe their injury is not healing properly, or maybe they're pale in the face, or they're short of breath. So your AI is going to be able to, oh, it's going to be objective and, oh, it could be any of these 10 things. Now, being human is the aspect of, hey, it could be this, but I'm not 100% sure. I'm going to word it in a way that, hey, maybe I'm not saying that you have this condition, but let me refer you to a doctor that might be able to give you a better idea of what's going on. Also, that same human approach to treating that thing, as opposed to AI might say, you have symptoms of lung cancer or blood cancer. That's a really harsh way to find out. And it could be wrong. You don't want a definite yes or no.
Mm-hmm.
I think it's better to be erring on the side of caution that it may be, but AI is not going to tell you a maybe. It's
Mm-hmm.
going to be like, according to all the symptoms and vitals that you've displayed and your past medical history and your age and weight and BMI and all this stuff, it's going to be able to collect a variable amount of data that could change on a whim. It could just be, oh, the weather's kind of bad and I feel it in my knee and that's why I'm not healing properly.
Mm-hmm.
Or I'm not being compliant at home. It doesn't know that.
Mm-hmm.
And it could just throw out a random diagnosis, which is why it can be helpful but also hurtful.
Mm-hmm.
I think it
That
should
makes
be
sense.
used as a tool, but not to treat. I don't think it should be the front line.
So yeah, you wouldn't. I mean, you wouldn't go to a physical therapy clinic where they're just feeding all your data into AI and saying, "Here's what the AI says,"
Yeah.
and so that's what we're going to follow, and then see what happens. Fair point. Um, so we talked a lot about rehab, right? We talked a lot about when you get an injury, what to do after it, or that's what we've talked about in the past too. I guess from your experience, from what you know, how are we getting people to do more prehab? How are we getting people to do the work beforehand so that if they have to come to physical therapy, it's for something they can't do, that they need help with, or they can't figure out, as opposed to, I wonder how many things people could have avoided just by doing the basics or doing certain things just on their own, and how could have avoided coming to physical therapy in the first place.
I think
Not to
that,
put you out of a job.
yeah. Um, I also, well, yeah. So I think that kind of ties back into like motivations and that kind of negative snowball effect. So if you tackle a problem early, you're less likely to have to tackle it later. If you are more proactive, it's better to be proactive than reactive because say you have cartilage or like you have a lack of stability in your knee and then you decide to go for a run one day. If you prehabbed it and as soon as you started to feel any kind of instability in your knee or it felt even mildly off, being proactive, going to get it checked out, getting imaging done, and figuring out what the problem is, going to the proper resources, whether it's an athletic trainer, a physical therapist, an occupational therapist, or even orthopedic doctor, is going to be able to tell you, hey, your knee is unstable or it's hypermobile, or hey, you're like the inside part of your knee is lacking strength. That's how you get into the prehab aspect of by regularly working out or targeting those muscles in those areas of problem and weakness in order to protect it so that later on it becomes bulletproof. And then you will not have a problem with that area unless it's like a genetic unavoidable condition. Those not much we can do. But we can be preventative and do what we can for the muscle and the joint in the long run. So tackling it while it's a small problem before it becomes a big problem.
What does it mean to be bulletproof? I hear that word used a lot when it comes to muscles and or joints, but mostly muscles. Of like, what does it mean to bulletproof your
It's
muscles?
I don't like to throw that term around too much,
Fair.
but I guess it was a bad example. Bulletproof basically means that the joint is so stable that it's not going to be a problem. So muscles are strong. They can go through full ranges of motion with ease without problems, and they can take on long loads of stress. And that's the way I see bulletproofing something. For example, if you have like tennis elbow, working on the forearm and stabilizing the forearm, stretching the right parts of the elbow, making sure that if you go through, say, a full competition, that elbow should not give you any trouble. That means it's bulletproof. It's not going to be injured because you've
Mhm.
done the work to get it there.
So how do you in general high level bulletproof something? Is it like
Repetition
is it high
and
rep type of
focus.
okay.
So, like, knowing what the stress tolerance and threshold of that muscle is, like, oh, hey, I can usually push it past this limit. not pushing it past that limit, going until that exercise is objectively easy before moving on, instead of pushing your body through extra limits and putting strain on that. So in some cases, it's stability. So working in like a horse stance might be good for your knees because it's putting strain on certain parts of it, but also allowing for stability of the knee in that bent knee position. So working on getting deeper and deeper and deeper and maybe holding those positions is going to quote unquote bulletproof that knee because you're reinforcing it by increasing the tolerance of load.
Mm-hmm. Mm. Interesting. I like that. That was great. No, that was great. I really appreciate that. I really appreciate the breakdown you gave. Before I let you go, 2 questions, per usual.
Mhm.
You came on here once before, and right now in my brain, I don't remember the exact one advice that you gave. But since you're back on, I have to ask you, what is one advice you'd like to give to somebody who's listening?
I think I said this last time, but be kind to yourself.
Okay. Okay.
Um,
I was interested to see if you did or didn't remember what you said last time, and to see if it would be different or not, or the same without remembering what you said last time.
so
Um,
yeah, being kind to yourself and taking it a day at a time. It's a marathon, not a sprint. So every step is going to be wavering a little bit. There's going to be parts where you struggle, but if you take it slowly, one step at a time, and trust in yourself and being kind to yourself, you'll end up at your end goal.
mhm. Love that. Love that. Where can people find you?
Instagram, it's going to be Meta Movement. I also, I believe, am working on Facebook and merch, so I will have those up pretty soon.
Mhm. Nice. Awesome. Once again, Vinny, thank you. Thank you for joining.
No problem.